providing resources and comfort to caregivers. This is Caregiver Crossing.
Good morning. That's right. You're listening to Caregiver Crossing. I hope that you're doing well on this lovely Sunday. If this is your first time joining us, Caregiver Crossing is a show brought to you by Joyce House and presented in partnership with Cardon and Associates. Thank you for being here. We were created for family caregivers and the people who love them, and we're here every Sunday to discuss all things caregiving.
That's it.
That's it. That's really it.
And hair loss.
Yes. Terry and I have been talking about hair loss.
So Candace is going to line up a guest for us to talk about hair loss. Is it stress? Is it my thyroid? Is it because I'm getting older? Mm-hmm. It's terrifying.
It is, but
it's
more
terrifying.
And more people are talking about it. More and more women, I guess I should say, because, women, our hair is part of our beauty. Like, I don't want to say beauty. We're beautiful with or without it. But like, look at the lady behind you on the wall. She's completely bald,
That's
but
right.
she looks awesome.
She's gorgeous.
But
yeah, you're right.
Our not personality. That's not the word I'm looking for, but just makes us. It's fun. It's accessory. It's one of our accessories.
It just scares you a little bit. And for those of you that have gone through cancer and treatment, chemo, I know in talking to many cancer survivors that when the hair loss goes, it is incredibly upsetting for a lot of different reasons. Mm-hmm. But not that I'm going through what you're going through, not in a million years could I understand that, except that I am starting to understand hair loss a little bit.
Yeah, me too.
So Candace is going to line up a guest in the next few weeks, and we'll talk about hair loss. Okay.
I'm not looking forward to it, but we are. So that's Terry Stacy.
Yep.
I am Candace Hadabaugh.
Hi.
You can find the past episodes of Caregiver Crossing at caregivercrossingradio.org, and be sure to go and like us on Facebook. This is going to be the best place to keep up to date in between shows and all the fun things that Caregiver Crossing and Joyce House has going on from week to week. And you can always reach out to us at 317-254-0828, or you can email Tina at tina@joycehouse.org. We love hearing from you. And we've heard from a couple people over the last couple of weeks for the vaccine clinics or about Teepa Snow. But last week, it was about our guest, Mike LeMayich with Global Funds Management. You can go to Caregiver Crossing Radio and hear that episode. It was very knowledge-packed. But his phone number is 800-279-4912. His email address is Mike, M-I-K-E, at gfmsafemoney.com. That's Mike at gfmsafemoney.com. And the website is gfmsafemoney.com.
There you go. He was terrific. He learned a lot about all kinds of things. I mean, he just was, I hope if you did miss it, please listen to it. Everybody can use the information that he gives to us. Yeah.
And just to kind of recap, we talked about wills and probate and estate planning, and he just made it so easy. So again, you can hear that episode at caregivercrossingradio.org. I
have something that I want to share with you.
What's that?
You go ahead. Whatever you were getting ready to tell. And then I want to tell you about something that I just saw on WTHR channel 13.
Okay.
And about nursing homes.
Okay. Do you have it now?
I do.
Okay, go ahead.
The United States, the headline is, the United States to regulate nursing home staffing for the first time. Advocates say it's not enough. Do you know about this?
I don't. What do they
mean
by?
Joyce House, we should tell you, is not a nursing home. Joyce House is an adult day care service.
Yes, thank you for that. We are different from nursing homes in that our clients, who we call guests, come to us during the day. So think during working hours, Monday through Friday, whereas a nursing home resident is going to stay there around the clock.
This was yesterday that I saw this story, and it says the federal government will, for the first time, dictate staffing levels at nursing homes for Biden administration said on Friday. The Biden administration said on Friday, this past Friday, responding to systematic problems barred by mass COVID-19 deaths. With such regulation has been sought for decades by allies of older adults and those with disabilities, the proposal threshold is far lower than many advocates had hoped. It also immediately drew ire from the nursing home industry, which said it amounted to a mandate that couldn't be met.
So are they saying that they're going to regulate like staff to patient ratio?
I guess so.
I thought they already did that.
No, I mean, maybe I'm not understanding it completely, and this is a pretty big story, and maybe we can get a guest here next week to talk about it, because this seems like a big deal.
Yeah, will you send that to me?
I will.
That's really interesting.
Some 12 million would have add staff under the proposed rules. The government insists a majority of the country's roughly 15,000 nursing homes, which house some 1.2 million people, would have to add staff under the proposed rules.
Okay. Yeah, that sounds like it's probably the ratio.
Yeah.
Which has been crazy. When I was working in the nursing homes, I mean, it was I think I had maybe 20 residents on my floor, and I was the only CNA during the day.
Oh my.
If I'm recalling correctly.
Okay, that seems...
So hopefully that's what that's saying.
So it sounds like a good thing? We'll find, I mean, I don't know. Yeah, right?
I think
there needs to be more information that I get.
I mean, if you think about it, if you've got more staff, you've got more hands to make quality of life better for...
That sounds like it.
Yeah.
But the nursing homes are upset about it, is what I'm reading.
Yeah, well, yeah, that would be more staff, more overhead, more
money.
Paychecks, yeah.
More money.
Yeah, send me that. I'll look into it.
Okay,
so we can get on for next week. Thank you,
all right.
Okay, so couple of things. You've been hearing about all of the things I'm getting ready to mention, but I'm going to tell you again. Joyce House is planning 2 vaccine clinics coming up. Wow, is that next week? September 18th and 19th. The 18th will be here at our Broad Ripple location from 4 to 6, and the 19th will be at our UIndy location from 10:30 a.m. to noon. They're free and open to anyone. So you bring yourself, bring your family members, bring your coworkers. Visit either our Facebook page or shoot me an email. You can email Tina at joycehouse.org. That's going to be the easiest way, and she'll connect you with me. But each person will be able to get a grab-and-go meal and a $25 gift card for getting vaccinated.
COVID, the flu, RSV vaccines, right?
And shingles.
And shingles.
And shingles. So Terry, get in line. Plan to come next week. She's thinking about it.
Thinking about it, but also I didn't. Maybe. Okay.
Okay. You can register. That link is on our Facebook page, but you can also just stop by during that time, and we'll get you vaccinated as well.
That's a good deal.
It is, and I think it'll be fun. It'll be if you have been interested in learning more about Joyce House or want to come see the house, it's a perfect excuse to do so.
I think vaccines in a group setting are fun. With food,
especially
grab
when
and
you
go,
get a sandwich and a gift card.
Listen, where else are you going to find that, people?
I love it.
You don't get that at the doctor's office.
Also, Teepa Snow, we've been talking about her on October 13th.
Yeah.
Tickets are available now at joycehouse.org/events/Teepa. If you go to the Joyce House website, up at the top, it says events, and it's a little pop down up there. You can click there. Tickets are free as well, and that is open to family caregivers and professional caregivers alike. And we are in our final few weeks of nominating the deserving caregiver in your life. So if you know anyone that you want to nominate, if you want to nominate yourself, we've got some cool prizes coming up. We've got a respite stay that's been donated by Cardon and Associates, our sponsor for the show. We've got some massages that have been made available, other gift cards. So it's going to be some fun little packages. Send your nominations to tina@joycehouse.org.
Okay, tina@joycehouse.org.
That's it.
All right. You ready to take a break?
Let's take a break. You are listening to Caregiver Crossing, and we'll be right back in just a moment.
Welcome back to Caregiver Crossing. I'm Terry Stacy, along with Candace Haddabaugh. Tina's out today, but we're really excited about our next guest who joins us in studio, Sargent Lance Dardeen. He's with IMPD Mobile Crisis Assistance Team. It's nice to meet you.
Thank you for having me.
How long have you been with IMPD?
For about 14 years now.
Oh, wow.
Moving into this, is this fairly new, what you're doing?
No, we started this in 2016.
Okay, 2016. And what is it that you do?
Sure. So the Mobile Crisis Assistance Team is a collaborative effort with the Sandra Eskenazi Mental Health Center, and we're partnered with licensed mental health clinicians. We respond to active runs, and we respond to follow-ups and referrals as well to try to get people connected to the most appropriate resources.
there's never been a bigger need for this department that you're with, this program that you're with. Are you busy? How many are there of you on this team?
So there's 7 teams. We are in every district, including downtown. We have 2 teams currently operating on the Northwest District.
Okay.
And we range from about 7:30 in the morning to about 6 o'clock at night.
What kind of calls are you getting?
Okay.
These are crisis 911 calls, people with mental health issues, substance issues, quality of life issues. We really just try to fix the whole gambit of issues. Yeah.
So someone calls 911 and they get you, or is there a process to getting to your team?
We are dispatched through 911, but we can self-dispatch. We can, if we get a referral in through like an email or a phone call to the city, we can go out then as well.
What's your day like? I mean, what is it like for you out there?
So we are called the barrier busters. So there's a lot of barriers to success when it comes to mental health services. So we really try to break down those walls. We try to facilitate families trying to get their loved ones help. We also try to create and maintain active police and community partnerships because we can't do this by ourselves. This is not a policing issue per se, but we are involved in the community. So we try to reach out and create those relationships with all the different mental health centers, treatment facilities, in different aspects of the community to try to get those individuals connected.
So you say make those partnerships like with people who are using those centers as services, or that they can maybe connect you with a pocket of where people may need the most help?
The first part.
Okay.
So yeah,
Gotcha.
we try to maintain those relationships. So if we come across an individual that may fit those services, we know who to contact to try to get them in the most efficient way possible.
Did you join Did you join IMPD because you wanted to do this type of work, or did it just happen?
This type of work did not exist when I joined the police department.
I wondered about that. I still thought this was fairly new, but it's not really. It's 2016.
2016. Okay. Now I joined in 2009. So there was a program that has been around for a while since 1988 called CIT. The Crisis Intervention Team, and that is a national type of program, and I got involved in that. And then in 2016, they created this unit because they felt that there was a need at the time.
Why did you choose to be a police officer?
Well, I actually had a DARE officer that was very impactful in my life, and I looked up to him. And he was a mentor, and I said, hey, I want to do what you do.
That's awesome. That's awesome. Okay.
Young? When you were young, you were?
5th grade.
In 5th grade?
Yes.
And you, from that moment on, you said, I want to serve.
Yes.
Again, the mental health crisis is in our news every day, and which is, there's a line there because I'm glad that we're talking about it, and I'm glad that those that need help are getting the help that they need. But so many aren't in our community. They're not getting the help that they need, but I listen to the police scanner. I do. And I hear the calls, constant calls that come out. And I also see the number of suicide rates that continue to and we see it in the news too. Your thoughts right now about where we are in Marion County when it comes to crisis?
Well, we're actually very lucky. You could probably take a stone and throw it anywhere when you're in the county and hit some sort of a treatment facility.
Right.
So we're very lucky. The problem is a lot of families and those in need don't understand how to get connected to those services because there is a waiting list sometimes, and it can be very challenging.
And expensive.
And it can be expensive.
Yeah.
So we do the best we can to just try to help individuals navigate the services.
Please go ahead.
Is there a 1-800 number that just has all of those resources listed?
So individuals can call 988 if they are having a bad day. It's a free crisis line. It's a national line, but it's run state by state. So Indiana 988 is fully established. It's been here for just over a year. Okay. And so individuals can call and help get connected to services that way. 211, they could also call. And then that's what our unit does is, we've developed those relationships locally. So if we come in contact with them, we can usually just make a phone call and try to get somebody in.
Okay. Terry, you got any questions?
Well, I was going to ask, how do you tie this into caregivers, right?
Well, I was just getting ready to say that. So I was watching it was either a TikTok or a Facebook video of this elderly woman. Her daughter had called the police because she was combative and had pulled a knife on her. So daughter called the police because mom had pulled the knife. So she went at the police officer with the knife once they arrived, and they shot her and killed her. Now, I know that's the training, but how can we equip families to not have this happen in the future?
To help to de-escalate the situation before they need to make that call.
Or, walk us through what happens when you get the call. What information do you need from us to know what you're walking into? All those sorts of things.
Well, there is some pre-work the families can do, especially when it comes to elderly Alzheimer's, dementia. Alzheimer's is the largest cases of dementia, but about 60 to 75% of all dementia cases are Alzheimer's. And so families, what they could do is when they think that a family member is going through that, first of all, try to get them connected to some sort of a neurologist, try to get that testing done. But then they can also start creating photo books. They can start building those memories from the past, and that can actually help de-escalate somebody because once the individual is able to see their past, and sometimes they can get that recognized and they can get some moments of clarity, which will help de-escalate the situation. The other thing they can do is, I brought with me, this is a crisis information sheet. I don't know if this can be shared online, but it has a lot of information that families can fill out before the crisis happens, because the last thing that they want to do and the last thing we want to do is try to interrogate families when we get on scene, like, hey, what's their name? What's their date of birth? What doctor do they go to? Are they connected to services? What medications do they take? Do they take those medications? What are their triggers? What is their current behavior? That's a lot of information in a crisis. So if they can fill out this information sheet that we pass out, they could already have that information, and that's going to make the situation a lot less stressful.
Now, is the 911 operator going to ask us these questions, or is this something we hand to you all when you come in?
They're going to ask some of those questions. They're going to ask more of like, what's the current behavior? Are there any weapons, any history of violence, things like that. But that's pretty simple. This sheet has a ton more information on there that can be useful not only the police, but all like first responders. So fire, medics, and us.
Okay.
In studio, if you're just joining us, we're glad again that you're here. But Sargent Lance Dardeen is with us. He's with IMPD Mobile Crisis Assistance Team. And we've had some good conversation. If you've missed it, Candace has got this posted online. Where do you put that, Candace?
CaregiverCrossingRadio.org.
There you go. Thanks for sticking around for this next segment, Sargent. Thank you for being here.
Thanks for having me.
He's been a part of this for a long time. And let's talk about this. In your experience, what de-escalation techniques are most effective when interacting with an agitated person with some sort of cognitive decline?
Oh, that's a great question. Well, first of all, de-escalation is an acquired skill. It's something that you should probably practice, right?
Yeah.
And I think most of us in our lives, whether it's our kids, family, have a lot of practice chances to de-escalate. The first thing that I usually start with is what's called emotional labeling. Have you guys ever heard of that? Right. So it's an identification of underlying feelings. So let's say, Terry, on break, we were having some audio issues.
Yeah.
And I could say, hey, Terry, I'm really sorry that happened. I'm sure that was really frustrating.
Well, it was frustrating. And I was about to come over the table and wrestle Candace.
Right.
So thank you for de-escalating me.
Yes. So if you start with emotional labeling and you identify those underlying feelings, that can go a long way. It takes about 3 seconds to do. It's very easy. It's quick. And it does a great job of setting the stage, developing that rapport, and letting the person in crisis know that you understand what they're going through. Because a lot of times we may feel alone. Like, I feel like this way, no one else knows how I feel. So when we label those emotions, that can do a great job of setting the stage for that de-escalation.
Yeah.
Okay, very good. So number one, first and foremost, just calmly, I understand what you're going through.
So I wouldn't say I understand what you're going through, because you probably don't, but just say, it sounds like this has been very insert emotion.
Okay, got it. Yeah. All right, Candace.
So yeah, you're just acknowledging the fact that they're upset about.
Yeah, let's say somebody was just a victim of a crime. You can say, oh, I'm so sorry. That must have been really scary to go through.
Mm-hmm.
Okay, what's next?
So make sure you talk in a calm voice. Okay.
Take it down.
Take it down.
Calm.
Slow down. Okay, time is on your side. You don't need to rush through this.
Can I jump in there?
Yeah.
I think that's even more important when dealing with someone that has Alzheimer's or dementia, who's already a little more delayed with their understanding. Because if you're talking faster when in a situation that's already agitated, that's just going to make them even more agitated.
Yeah.
And I get excited easily anyway. So I just need to, that's going to be one I have to really remember, is just bring it down.
Right.
Calmly.
Yeah.
Okay.
The next technique is to build rapport. So try to find some sort of common ground, however you can do it. Look at their t-shirt. Are you inside their house? Look at the decor they have around their house. Do they have a Colts t-shirt on? Oh, you're a Colts fan, right? So use anything you can to build rapport. I had a lady in crisis one time. The only thing that I had, her name was Phyllis, and my mom's name was Phyllis. So that was the only thing that I had to use as rapport. So I used it.
Wow.
So also make sure you give your undivided attention. You know, we have that thing in our pockets, you know, called the cell phone, right? Yeah. And that can be very distracting. There can be a lot of loud noises. So you just want to try to give that individual the most undivided attention that you can. Give the person a chance to talk. So they should be doing most of the talking. So encourage that, but give them time and don't interrupt them.
Okay.
And also, you want to make sure you use appropriate body language. So did you know that about 90% of the language that we have is nonverbal communication?
I didn't know that the number was that high.
Yeah, only about 10% of our communication are the words we actually use. So, you know, even the listeners here, they can try to finish this phrase. It's not what you said, it's...
How you say it?
How you said it. Mm-hmm. Why do all of us know that? Because we've all had it done to us, and we've all done it to somebody else, right?
Yeah.
Our body language, the inflections on the words, how we stand, our arms crossed, you know, all that stuff, that is very important. So just make sure you're using that appropriate body language. And then silence is okay. If you've ever, you know, been in a situation that's stressful, sometimes just sitting with the person in silence is a good way to de-escalate.
Just being in the room with them.
Just being in the room with them sometimes, and try to get down on their level. So you don't want to be standing, you know, over somebody, right, with that intimidated look. You want to get down to the person's level. And one thing you never want to do, never say calm down.
Oh.
Because when in the history of calm down has anyone ever calmed down by being told to calm down?
I thought that was just couples. I thought that was just a married couple thing. No.
Yeah.
Never say calm down.
Never.
I know with dementia patients from time to time, they're talking telling things that I don't know, or I don't remember, or I don't understand. And is it good at that time just to continue agreeing with them when they're in a crisis situation and they're spewing things and things are coming out, agreeing like you would if they were in a calmer situation, which I'm told to do with Alzheimer's and dementia patients, is to agree with them. You know, if they say, you know what, it was 1950, it's 1957. Okay. I know what day it is. And you just agree with them, I'm told.
I think it's, and then I do that all the time.
Me too. Well, I do too.
Every year is a different year around here.
Right.
So,
yeah.
You know,
but in a crisis situation, continue that conversation. Yes, you're right. Or just agreeing. Do you think?
So I don't agree, because I don't want to further that, that expectation of this is what's going on. But I like to divert. So if they say, no, it's 1977, well, how's that making you feel? Is there any stress that's going on? Tell me about that. And so I kind of just focus more on the stress side of things and divert that. Okay. Very similar to somebody that may have like a psychosis. You never want to agree with the psychosis, but you can divert away from it.
Okay.
Interesting.
Yeah.
Okay.
I've never thought of it like that.
Me either, but I'm learning things. I'm learning from you. Thank you. And I know our listeners are as well. What is there anything else? What else you want to say when it comes to de-escalation?
Try it.
Try it
Just
before
try
you
it.
make the call.
Yeah, to try it in situations where, the situation isn't as dire. So let's say that, you have a 5-year-old son that doesn't want to brush their teeth, before bed. Try it with them. Try these techniques out, learn. And then there are classes that anyone in Marion County can take. It's called Mental Health First Aid. It's a great class. You can Google their website. You can use the search engine to find classes near you. And that's an 8-hour course. And it does a fantastic job of teaching you how to recognize signs and symptoms and how to de-escalate and really help people in those times of need.
That's really interesting. Mental
is
health
interesting.
first aid.
Yeah, we should have them on. We
Yeah.
should bring in somebody from there
Absolutely.
to talk about that course. Beautiful.
Got it.
Okay. All right. What else?
Oh, that leads us into the next question about insight on training and ongoing education. So can you tell us what that looks like from the officer side?
Yeah, so on IMPD, we do a lot of mental health training. There is some mandated stuff. So there is in the code, in the Indiana code, it's actually 5219, if you wanted to look that up.
Ooh, say again?
So it's 5-2-1-9. And that actually mandates all law enforcement in the state of Indiana to go through very specific types of training. And that includes Alzheimer's and dementia.
That's good to know.
Every year.
I didn't realize that.
Yeah, so we go through different trainings every year, but we also do CIT training. So the Crisis Intervention Team, that's a 40-hour training on mental health. Every officer with IMPD goes through mental health first aid training. And there's a bunch of other, in-service trainings and little things that we can do.
We've got to take another break, but we'll be right back with Lance and Terry and myself and more Caregiver Crossing right after this. You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardon and Associates. With 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience, Cardon and Associates provides residents with the best senior living options and personalized care. Visit cardon.us for more information and to find a community near you. Stay put. We'll be right back with more Caregiver Crossing right after the break. Thank you, Terry. I've missed all the snaps and the clicks and the bangs.
Loving the music.
Welcome back. We are in our final segment of the show this week, and we've been joined by Sargent Lance Dardeen. Thank you for sticking around with us. Did I say your name right?
This has been a lot of fun. Thank you for having me.
Good. I'm glad you were able to join us. Sargent has been talking with us about mental health crises and what to do and how to de-escalate, and has given us some great numbers and great resources that we'll make sure are linked in the show notes and on our Facebook page. So just a couple more minutes here. Sargent, can you tell us how families and officers can collaborate with healthcare professionals and social workers during a time of crisis?
Great question. So the first thing that I would do is something that should be done before the crisis happens, and that is trying to sign what's called an ROI with the treatment facility. And an ROI stands for Release of Information. Mm-hmm. And it allows the family to talk to the treatment team, to the doctor, back and forth. If for some reason the family can't get an ROI signed, it is important to still communicate with the staff if something happens. So let's say that your loved one walks away. The police pick him up on 65 South, and he's dehydrated and they had to take him to the hospital. The treatment team of that individual needs to know that happened. So the family needs to communicate with them, and they are 100% able to do so. So don't let somebody at that facility, maybe it's, they're new and their first day, and they say, well, no, you can't tell me that. That's a HIPAA thing. No, the family can tell them as much information as they want.
Right.
They have that right. Now, without the ROI, there usually is no reciprocation, so they can't tell them, what happened at the appointment or, anything like that. But the family can 100% always tell the doctor or the treatment team stuff that has been going on.
And when is a good point to have that on file? Is that something, as soon as mom or dad or Uncle Buddy gets that diagnosis, we need to have that on file, or should we wait until something happens?
No, as soon as possible. Okay. Yeah, try to get that ROI signed as soon as possible.
Okay. All right. Anything else on that particular topic?
No.
Let's do this one then before we get you out of here. Any resources for caregivers who have a loved one who wanders? We just kind of mentioned that a little bit. Maybe in a tracking bracelets. Years ago, we heard about tracking bracelets you could get from fire stations. And then we discussed this topic just a few weeks ago, and that's kind of what sparked our interest in having you come in. Tracking devices, or what for those that wander.
Yeah, so the new popular one is the Apple AirTag. And that is something that you can maybe put on somebody, put in your pocket, the backpack.
Either.
Absolutely. And it works fantastic even for kids. My daughter uses it for my grandson, just to make sure that he's in a safe place, right?
Oh my gosh, I never thought about the iTag.
Yeah.
Well, I've been hearing about it because people are like crazy and stalkers and sticking them in things to track people.
Oh, yeah.
It can be used for good too.
Okay, we'll see.
Yes.
Yeah. We should have had you on last month.
Yeah.
With the air tags, though, they still don't have geofencing, so you can't put a fence around maybe a place. So if they leave, that it's going to alert you. But there is something called Project Lifesaver, and that's probably what you were talking about earlier. And you can go to the Project Lifesaver website. You can type in your zip code, and it's going to give you the closest facilities that will help you get connected to Project Lifesaver. They usually are fire stations, but it could be other locations as well.
And if your loved one has a cell phone, my husband and I and my mom and my sister actually have Life 360, the app that shows the location and shows how fast they're going in the car, or if there's like an automatic or an abrupt stop. All kinds of things. If they're walking or running, you can see Life 360. Mm-hmm. So I like that. It's a little purple icon with some white squigglies in there.
This is all really good stuff. Apple iTags, Project Lifesaver, and the Life 360 app that we're talking about today. Really good. Anything else?
Not that I know of. No.
Okay, great. Really great conversation. Sargent Lance Dardeen with IMPD Mobile Crisis Assistance Team. And before we let you go, you showed us in the first segment we talked with you a sheet of information. And again, just go over that quickly if you can. And Candace is going to take a picture of it and put it on our Facebook page too, right? Okay.
Yeah, so the crisis information sheet, it has a ton of information about your individual or your loved one. So, what is their history? Do they have mobility problems, communication problems? Are there any concerns, medical concerns? What is their current behavior? So have they been depressed? Have they been confused? Do they have delusions, hallucinations, disorganized speech, things like that? Have they had suicidal or homicidal thoughts? It goes into provider information. So like, what is their diagnosis? What services are they in? Medications, their treatment team, what preferred hospital they would like to go to, any triggers that they have. And then what information do first responders need to know? Because it's not just police, fire department, EMS personnel could be interacting with your loved one as well. Any suggestions on interventions or de-escalation techniques? So, do they like old Ford Mustangs? And if they do, let's talk about Ford Mustangs, right?
It's just such a great piece of information to have, all of that for you and for the family to have. So we'll get that downloaded. Thank you. Thank you so much. You're terrific. Come back, see us.
He has to come back because he has to tell us about the mental health first aid and all of those great things.
It'd be great.
So we'll see you here soon.
Thank you.
Cool. All right. As we wrap up the show, if you have any questions, any suggestions of people you would like to hear us have on the show, you can email Tina at tina@joyshouse.org. What else? Let's recap. So we've got the vaccine clinics coming up on September 18th and 19th. We've got Teepa Snow on October 13th. And don't forget to nominate the deserving caregiver in your life. You can send those nominations to tina@joyshouse.org.
And also thanks to our Caregiver Crossing, and we're supported by Cardon and Associates, 20 communities owned, operated, or managed in the Midwest, and more than 40 years of senior living experience. Cardon and Associates provides residents with the best senior living options and personalized service. Until next time, take good care of each other. Thanks for listening today.